Perfect, thank you.
Yes, sir. Very well. So when you look at your MRI here,
Mm-hmm.
so when you look at at these different sequences, so ACL graft here
Right.
looks good.
Good.
Okay.
Yep.
Your PCL is this ligament behind it, which looks fine.
Good.
You've got some variable areas. See this right here?
Yeah.
That's bone.
Yeah, Tony mentioned something about a little bone area.
You've got a few of them. Look at this. This are all little bone chunks kind of toward the back of the knee, which I can tell you, that ain't a month old. That's been there.
Okay, that's fair.
So what do you do about it? I'm not sure I would do anything about it.
Okay.
I'm not sure that's a new thing.
Do you know what would have caused that? And if you don't, that's fine. I mean,
It could be, we'll see little chips that get bigger over time.
Right.
Some of this could be bone spur. See how there's a connection to the tibia there, big old bone spur in the back?
right.
But that's a fair amount of it.
Okay. And this is at the back.
Yeah.
Okay.
Yeah. Let me switch sequences here and show you something here. So to reference you, this is the kneecap in the front.
Okay.
This is the inside of the knee. There's the meniscus right there. This is the lateral side of the knee.
I'm sorry, lateral is...
Lateral's outside.
Okay, lateral is the outside. Okay.
Yeah. So what you'll see on the inside of the knee is you'll see the meniscus in the front. Looks pretty good. There's a little flap down there. That doesn't belong there.
Oh, good.
And as we start, that's a bigger flap there that doesn't belong there. As we start to come in here, you got a little defect in the meniscus there. So you definitely have a medial meniscus tear.
Okay.
So this should be a nice black wedge of meniscus or cartilage material. See this little thing here? That doesn't belong there. That black portion
Okay.
should be kind of up in this area.
Should be up with all the rest of it.
That's exactly right. So almost like there's a little flap that you tore, and now the flap is
Hanging down.
hanging down. That's exactly right.
Oh.
So that is on the inside of your knee,
Okay.
and that's where your pain is. Now, do we have to do anything about it? No. Is there a potential need to scope the knee and kind of take care of that and remove that portion? Potentially.
Okay.
The lateral knee, you have very little meniscus left.
And the lateral is the...
outside,
This.
where you don't have any pain, ironically.
Okay.
And that's also where your arthritis is the worst. So you see the gray area between the bones here, these two gray layers?
Yeah.
Laterally, you see it in the front of the knee. As you start to go toward the back of the knee, you see the white area?
Right.
That's fluid that's interposed where cartilage should be. So the back lateral side of your knee, that cartilage loss is pretty significant.
Okay.
And that's what arthritis is, right?
And honestly, most of the pain's on the outside or the inside. I'm sorry, the
I think
inside.
I think it's that new meniscus tear.
Probably. Okay.
Because a lot of this stuff you've been living with for a long
Right.
time.
Yeah.
There's your ACL graft in the front, which looks good there.
Yeah. Everybody said the ACL's graft's been fantastic.
Been fine.
Good.
Yeah. I can tell you, and I'm not implicating anybody because
Yeah.
my knees look just like this.
Okay.
Your graft is very vertical,
Okay.
not very anatomic, and so's mine.
Okay.
We now put grafts down here because it's a more anatomic placement. If you look at my knees, my ACLs are just like yours.
Okay. Is that just a generational?
That's exactly right. It's
Okay.
just a technical thing. We get better with what we do, and now we're putting it more down the wall to provide better rotational stability. Now, you're not going to mess with that, obviously.
No. Hopefully.
But I think this meniscus tear is a new issue.
Okay. Which makes sense because I'm having all the pain and all
Yeah.
that fun stuff.
But you got, if you line up, 100 guys, you're 40, right?
I am,
You line
yes.
up 140-year-olds, you're top 5 knee arthritis. It just is what it is.
That's bad.
Yeah.
Correct. Okay.
But you're still thin, you're active, you're working with it. So, I think as time goes by, you're going to need to just be more and more careful with your activities like I am. It's just going to pain. You're not going to want to pain.
Right.
So, running, I'm surprised you still do it, quite frankly.
Honestly, it's just sprinting. I don't do any long
Yeah.
distance running because
Yeah. I don't know if I do that.
yeah, I'm getting that I'm getting that impression.
It's funny, I quit at 40. I quit running at all. I'm like, I'm not doing it anymore. I'd run and I'd ache for 2 weeks. I was like, I'm done with this. So you can do things.
Correct, but
you're going to start to learn. I'm going to be more of the swim, bike, elliptical, weights, and not the
running, pounding.
Yeah.
Gotcha. Okay.
Does that all make sense?
Everything makes perfect sense right now. Yes, sir.
Okay. So you're feeling better?
I am feeling better. This doesn't hurt. just sitting like right now, I mean, there was a little sensation of discomfort, nothing bad.
Not too bad.
Again, it's more of an annoyance than anything, but it's not horrible.
Well, you can tolerate some. There are patients that have knees like yours that aren't super happy. I mean, your ability to tolerate it is there, obviously. The question is, how much is that meniscus going to continue to bother you?
Correct.
Is the bottom line.
Yes.
You know? And if it does, we could try injections. We could scope the knee and kind of smooth out that torn segment. You can't really repair ones like that.
Because it's all the way dislodged or
once you have a
torn off.
displaced flap like that, I think the utility in repairing it and the ability to repair it is not very good.
Okay. Gotcha.
Yeah, let me just take a quick peek.
Yeah.
If you don't mind.
I don't mind at all.
Yeah, that'd be great.
You want to pull both up for comparison?
Yeah, that'd be awesome. Yeah, you're getting a little bit too good at this knee stuff.
Unfortunately,
Yeah, it's still a little bigger than the other one. You do some kneeling?
Yeah. I put a lot of pressure on this. I had to pick something up at work, so.
Yeah, you can just see a little bit of dry callus there in the other knee.
Yeah.
Yeah, you lack a little bit of extension.
Correct.
Just a few degrees. Sorry.
That's okay.
You're about, what, 115, 120? Okay.
I don't know what to say.
Something like sore there.
That's sensitive, yes.
Yeah, that's the spot. Nothing laterally,
No, sir.
nothing in the back.
No, sir.
Good.
It's all in that one spot.
Nothing there.
That just feels weird.
Yeah, just a nummy feel, huh?
Yeah.
Any patella pain, kneecap pain?
No.
Okay. Yeah, God, it really just depends on you.
Okay.
You can stick a shot in there if you want to try that, like a steroid or something.
To do what? Sorry.
It's purely an anti-inflammatory. So
Okay.
nothing that we can do will structurally change your knee.
Correct.
Other than surgery. So you can consider anti-inflammatories, ice, selective injections to manage the pain.
Mm-hmm.
If you're like, all right, I know what I got, I'm gonna just kind of see how this goes for a little while, very reasonable.
Okay.
If you came here today and said, this is really bad, I want to get this, inside of my knee pain to get better, I'd scope it.
Okay.
Because the tear's there, it's evident. I mean, it's not like, maybe, it's
Right.
there.
It's very
And
evident.
the ability for that to heal is not great. Sometimes patients have meniscus tears and just don't have pain. A lot of people do, actually.
Really?
Mm-hmm.
Okay.
And you can argue a case to give it another month just because it may continue to get better and you may not need surgery.
Okay. And just work on now. Sorry, I'll let you finish.
No, go ahead.
So because I really don't want surgery.
I wouldn't right now.
Right.
I really wouldn't.
So, what can I do in a month, 2 months to make life better and hopefully eliminate surgery totally?
I mean, I think the key is your activities.
Mm-hmm.
Sprinting.
No, wait. Okay.
Yeah, don't do that.
Yep.
Um,
What are some things I can do to help rather than things
Not
like
a lot, I think. This is either going to get to the point it doesn't bother you or it will bother you, even with just easy daily activities.
Mm-hmm.
There's nothing you can do to potentiate healing. I think that the biggest issue would be, potentiating. Sometimes these tears can get a little bit worse with activity. It really boils down to kind of be smart for a few months, and it's either going to bother you or it's not.
Okay.
Now, symptomatic relief, ice, Advil relief,
Mm-hmm.
and that's basically what you can do.
Any physical therapy stuff I can?
I'd never hurt you,
Okay. So I can get into lunging, squatting.
I hate that stuff to begin with.
Okay. That's fair.
Yeah.
I'm just trying to strengthen. I know muscle strength.
I tell you, did you do some therapy back when?
Well, obviously after the ACL recon, I definitely did, and I've obviously tried to stay active and stay strong.
I mean, you may, and I do this a lot with patients. You may want to work with a therapist like once and say, okay,
Mm-hmm.
this is what I have. I want to learn the ways to get strong, but not aggravate my knee.
Right.
Because there's certain type of like open versus closed chain exercises that can be, open chain means your foot's dangling, closed chain means your foot's on something.
Right. Okay.
Whether it's the ground or a sled, and there are open chain activities that will make your knee worse.
Gotcha.
So there's, I think, some utility in just having a therapist say, all right, here's the stuff you can do long term, here's the stuff you should never do.
Right. Gotcha.
So there may be a role in that for you.
Okay.
But I think it's time, and I think this thing's either going to behave or it's not.
Okay.
I really do. If it doesn't behave, it's a scope. Put a camera in there and kind of look at all this stuff
Okay.
and address what we can.
And so this would be, and I apologize. So, from my understanding, there's 2 scopes. There's repair and remove.
Right.
And this would be the remove.
Yes, which is 90% of knee scopes.
Okay, and so that's 7 to 10 days non-weight bearing?
No, that's full weight bearing right away.
Oh, okay, sorry.
Yeah, no. We kind of look at the loose bodies. If we get the easy ones, we can take some of those out. Arthritis, you can't fill in. Cartilage loss. Bone spurs, you really don't take them out unless they limit your motion.
Mm-hmm.
These little peripheral bone spurs, they just grow back and you'll bleed and be angry with me, so I wouldn't go aggressively after that.
Gotcha. Okay. Deal.
But yeah, you've been contending with some arthritis for a while. You know that.
I know, but as
Yeah.
you said, it's not been something. I sleep fine. I haven't.
It's great.
Yeah.
Awesome. Now, I bet that'll be that way for a long time.
Good.
But you, like me, we're going to have some metal and plastic on our knees at some point. It's
Yeah.
going to be hard to elude for both of us.
Correct. Well,
Not
sorry.
now.
Yeah, sorry to hear that for you too.
That's all right. That's what it is.
It is what it is.
Yeah. There's certainly worth things, but
Okay. So how much time would you like to give this to
I'd do another month. We're 2 months now.
from initial?
No, wait, what am I thinking?
2 weeks. 2 to 3
Tony
weeks.
saw you 3 weeks ago and it happened just prior to that.
Correct.
So
Happened Friday before. It's about 3 weeks.
Yeah, I'd still go another month, 6 weeks, 2
Okay.
months, something like that.
Okay. And then so go see a PT.
Yeah,
Find some exercise to do. Get stronger.
perfect.
And then in 2 months, if I call and say I have no problems whatsoever.
Forget about it.
Okay. And then if I come and say we can deal with different levels of, it's an annoyance or whatnot, and then we could get the scope done, shave it out, and then take the physical therapy rehab, and then be back to normal.
Yeah, back to your baseline as you were.
Correct.
2 months ago.
Yes, sir.
I was thinking mid-October for you.
Oh,
Yeah, I'm losing my mind here.
that's okay. I'm the last guy today.
Yeah, that's all right. We should be. Should be on it for the day.
Gotcha. Okay.
But yeah, I mean, if you're better in a few weeks, that's a good predictor. This
Okay.
might just slowly, progressively get back to as you were.
Okay.
And I could check in a month, 6 weeks. I could wait to hear from you. It's really up to you.
My only thing is, let's say in 6 weeks, I want to talk to you. Is it going to take 6 weeks to see you after? You know what I'm saying?
This time of year is terrible for us because I pull out of office and do more and more surgery at the end of the year.
Gotcha.
So this time of year is
It's
really
deductible.
bad for us.
Right.
Usually January, we get much better at that.
Okay. So if
we
I
can still put an appointment in the books in 6 weeks.
okay.
Just
And we can cancel.
work off of that.
Yeah, I think that would be. I would like that a
let's
lot.
do that. Yeah,
Okay.
yeah, that'd be great.
I'm trying to see if there's any.
I like the small pen there.
Sorry, I take this to go work out. I write all my. I did
Do
20
you really?
minutes of this. Yeah.
Yeah, it's nice to be organized that way.
So we're gonna go with no surgery right now, and you're okay with that?
I would do that.
Okay.
If that's my knee, I would not get operated on right now.
Perfect.
For sure.
If I had to ask you how old my knee was, so I'm a 40-year-old guy. How old my knee? If I
You mean like the typical patient we see?
yeah,
I mean, we
if a
see.
40-year-old guy walks in here,
Oh, you're much more arthritic than almost all.
correct?
I mean, we see 80-year-olds with beautiful knees. We see 20-years with more arthritis than you have. So it's a
Okay.
spectrum for sure.
Gotcha. Okay.
But yours is you are much more arthritic than we like to see in a guy that's 40.
Okay, that's pretty good. That's
Yeah.
what I wanted to hear, but I understand
Yeah.
my question.
Yeah.
Okay. So in the meantime, see the PT, get the exercises done, avoid stupid common sense stuff.
Yeah. Yeah.
Is there anything like day to day I shouldn't be doing right now that you would know about? Like for example, if I have to pick up a bag of leaves and walk it to the trash can. Okay.
If you get to an activity and you're like, then just don't do it.
Okay.
You know what I mean? If you're like, I wonder if I should do this or not. I won't for a
So
month or 6 weeks.
should I try and I don't want to say exert's not the word. Like I can't go down. I'm nervous to go down steps because it's the point where it bends.
Mm-hmm.
Should I try and go downstairs, or should I just go down steps like an adult, or should I just let time take care of it?
Not that time. Dude.
Okay.
I would take the cautious rest slant right now.
Okay.
Versus let's try this out.
Gotcha.
You know, I'd give it a good month of that.
Okay. That's fine. Well, like I said, I'm not going to be doing running. Definitely near time.
Yeah.
Can I do like? Because I want to get back to exercise. I've been eating and not doing anything. Can I do like push? Can I like
Yeah.
put my toe on the ground in like a plank position?
Yeah.
Is that stable enough for the knee?
No, absolutely.
Okay.
I think that's fine.
Okay.
Yeah.
Perfect. Okay. Awesome.